uh, in polypharmacy, all you need to know how you can stop the polypharmacy. So if you are talking about here, the adverse reaction in many older peoples may present as a delirium, falls, fracture, urinary incontinence, and fecal incontinence. So they can ask you the complications of the polypharmacy. So there are certain these complications. Principles for the prescribing in the older is basically you have to take for the cautious age, regime, education, and discontinue unnecessary medication. Then you are talking about preventing polypharmacy. How you are going to do is consider the drug. Is it safe? What are the potential benefits and side effects? Then consider patient other medications, clinical indications, and medical more comorbidities. Consider the patient drug interaction. Then review the drug list, what they are taking. Is they taking two medicines with the different class for the same thing? Then review drug list regularly to eliminate the medications which is not necessary. Like if some patient is taking 15 medicines, uh, where he's taking vitamin B12 separately, calcium separately, vitamin D separately. In that case, you can just put one multivitamin, and along with that, you can save so many of them. So that's how they are talking about. Avoid treating an ADR with another medication, like any kind of acute condition. Don't keep on adding drugs over that. And then if you are adding another drug, at least discontinue the previous one. So inappropriate prescribing, that one is stop and one is start treatment. Stop is basically screening tool of the older person prescription, and then start is screening tool to alert the physician to write treatment. So this is basically a role for pharmacist. But how you are going to do is basically you have to base list of medications contraindicated in the adult more than 65, base list indicated in that adult more than 65. So patient who cannot take in the chronic renal diseases, what medications they cannot take, in polycystic disease, in aneurysm, in heart conditions. Like there is very different charts, and usually it's been provided to us. Like wherever I'm working, the pharmacists do give us those charts where they tell us this medication cannot be used. So this is what they're talking about. Then you can see a little bit from here and can give you an idea what you need to know. Yeah, I think that's about it from geriatrics. I mean, any case that is where they're talking about the age more than 50, age more than 60, that is related to geriatric. And then they do like to ask you if you are able to think of the normal perspective, like normal perspective means thinking of what you can do for that person. Let me see where the genetics is. Genetics. Can't even think. Just trying to see where the genetics is. Let's see. Is anyone aware of where the page, like the chapter genetics is? I'm trying to find it, but I cannot. This one, and then this book is so annoying.
Dr. Kainath, I can't see any genetics in the Toronto Notes Index.
There
Oh,
is,
medical genetics. It's in the M category.
okay, and
Medical.
then you know the page number?
This is my different book. So we go in the M category. So if it is G, go more down and go in the M.
Okay,
Mhm.
let me see. It's like 780. It's just in this book, you cannot go by the other way. When I was using Toronto Notes 2022, it's very good. You can just check it and then go there. Okay, here it is. I'm talking about this one, below infectious. Mm, six. Should have paper before. This one. Yeah.
Dr. Kanath, it's after infectious disease. So you
Mhm.
can go
Round.
first hematology, then infectious disease, and then medical genetics.
Okay.
Alphabetical order it is.
Yeah, on infectious disease. Looks a little bit. So, in the infectious disease, without wasting time, let me tell you the most important is Down syndrome. Just not Down syndrome. You have to see what are the complications, what are the diseases that is linked with the Down syndrome. Everything, whichever things you find related to Down syndrome, wherever you are finding, not just Toronto Notes. Don't limit yourself. Go to ChatGPT, go to USMLE Step 1 and read at least the Down syndrome from everywhere, whichever possible way, because there is something that is very not enough here. Okay, we already are here in the medical genetics. Okay, so here the thing that you need to do is the which one is X linked and which one is Y linked. Other than you don't need to know anything. So see which one are X linked diseases, which one is X linked recessive, which one is X linked dominant, and which one is the other one, autosomal dominant and autosomal recessive. uh, because that is very, 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 very important. And so much questions can be asked from that one that is X linked and that is Y linked. I think I do have a table somewhere. If I find it, I will share it with you. And I just only did that table. Mm, this one, the karyotype fish microscopy, is like mainly with the obstetrics, how you'd go for which one test and which one. All you need to know the remember the names of it. And if you have time, then you can go for the uses and indication. Techniques is not important. You can remember the uses and and indications, just give it a read. But if you not at least know the name, what are the name? Karyotyping, fish, microarray, Sanger sequencing, and NGS. That's it. Then the multiple anomalies that comes together, only the main importance, the vectoral one, the charge one, the Vega one, if you can remember those ones. This is like the whole examination how you do for neonatology, like a face checking for ears, nose. Like it can be asked in a screening, what is the screening for that? What would you like to check in a neonatology? So thing checking for hearing, eyes, those ones are more important than going for anything else. Then definitely we go for checking for thorax and genitalia. You like I saw a baby today. He was 15 days old. So my job was as a family physician to check for the examination, like overall examination. So I checked the reflexes. I checked for the pelvic click. I checked for the neck holding. I checked for the grasp reflex. I checked for the sucking reflex. And along with that, I also checked the chest. If there is, I'm checking for neck, nose, genitals. So don't forget to open the diaper and check the genitals as well. Okay. So this was an overview of that one. If possible, you can do the weight as well. Reoccurrence risk and prenatal screening and medical care and the genetic care. So now this one is important. When you are talking about Down syndrome from everywhere, anywhere, and each and every single word of the syndrome is important. So then we are talking about here is the cranium. It has a mild microcephaly. Every word you have to remember on your fingertips when it comes to Down syndrome. Mild microcephaly, flat occiput, then the third fontanelle and brachiocephaly. In the brain, you will see that. When it comes to eyes, upslanting palpebral fissures, apicanthal folds, speckled iris, refractive errors, acquired cataract, nystagmus, strabismus. When it comes to ear, low set ear, small overfolded upper helix, then acute otitis media. One of the most common thing that is basically in this one, acute otitis media is very, very common and a frequent otitis media. So in the frequent otitis media, this can be asked which other disease it could be linked to it. So it's basically Down syndrome and hearing loss. So with it does cause sensorineural hearing loss, and it also, because of the otitis media, causes conductive hearing loss as well. So in Down syndrome, both of the hearing loss could be possible. Then the protruded tongue, large cheek, low flat nasal bridge, and small nose. Then the short stature, excessive knuckle skin, then joint hyperflexibility, increasing dysplastic hips, then vertebral anomalies and lentoaxial instabilities. In cardiac, we check for the which one? Very, very important, the atrioventricular septal defect. Then the gastrointestinal, duodenal, esophageal, anal atresia, tracheoesophageal fistula, Hirschsprung. Hirschsprung is very, very important. Then chronic constipation is one of the most common. And that can be asked with like a chronic constipation is there. Which are the syndromes that can be linked with the neonates? So in that one, you have to think of hypothyroidism and Down, and then you can think of other things as well. Then the cryptocorticism, and then rarely fertile. In CNS, hypotonia, a baby with hypotonia, low IQ, developmental, hearing problem. They keep on saying hearing problem, and it's important. Onset of the Alzheimer disease in 40s. Other features is basically single transverse palmar crease, clinodactyly, and then absent middle phalanx or the fifth finger, polycythemia, hypothyroidism. That's why I said hypothyroidism itself is important. It is also linked with Down syndrome too. Then don't forget about the prognosis. In this one, long-term complication. This can be asked like how or which future abnormalities you would like to check in the Down syndrome. Which one or that one? CBC, echocardiogram, because it can cause heart conditions, yearly thyroid test, atlanto-occipital X-ray of 2 years, sleep studies, hearing test, ophthalmology assessment. Very, 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 very important. It can be asked like in upcoming hearing assessment, how do you do for the Down syndrome? Down syndrome is something, it can be linked with many diseases. So this can be asked after 40s, uh, which diseases are very common in Down syndrome. So we just studied, if anyone can tell, this is basically Alzheimer disease they are asking for. In every yearly test, what is the test we do? Thyroid test. So things can be asked in just like, straightforward questions. But if you don't know, then you don't know. Then, which one else is there? Trisomy 18, that's Edward syndrome, and 13 is Tau syndrome. In that one is basically microcephaly is there. In this one is also microcephaly, but it has a prominent occiput, but this one has a scalp defect. Microophthalmia, like if you see the baby picture, then it will be more easy to remember. Then iris coloboma, retinal abnormalities. In this one is microophthalmia and then corneal abnormalities. So this can be given. This one has retinal problem and this one has corneal problem. Low set ears, malformed. This has also so low set. Then this has cleft lip, small mouth, and microgenthia. This can be asked if there is a child who has small mouth, microgenthia, and blah blah blah. So usually I memorize only specific crazy things which do make sense to me. Like I in this one, if you ask me, I only remember that this is micro. So there are many things in Edward that is very very small. What are those ones? Microcephaly, microophthalmia, microgenthia, everything is small if you think of this way. Intrauterine growth restriction, even the baby is small. Clenched feet is there, hypoplastic nails, even the nails is like the problem. Then there is which defects, VSD is there, ASD is there, and PDA is there. Hernia, tracheoesophageal fistula, then cryptocorticism, then hypertonia, rocker bottom feet is one of the very common. So I remembered Edward do cause the rocker bottom feet and has everything small. So small for gestational age, intellectual disability in the survivor. For me, Edward has everything small. Then comes the Tau. It has everything small, but it has so many. So microcephaly, microphthalmia, small head size, bulk polydactyly. It has many defects. What are those ones? 80%. As you can see, if you compared Edward with this one, Tau has 80%. So it means it has more. Okay, it has more polydactyly. It has 80% more AST, PDA, VST, polycystic. It has more kidneys, hypertonia, seizures. It has more having fits. Okay, so umbilical artery single, then scalp hypertension. So if it does make sense to you, like that's how I try to memorize and make sense to me. Because in the exams they do give like, oh, this has polydactyly. If you keep on thinking what was inside that one, then you will keep on thinking. So for me, if like, oh, more, it was in that Tau syndrome. So I just tick on that one. Okay. So then comes the genetic syndrome, Fragile X, Klinefelter, Turner. Turner, everything is small, like web neck, it's a female, unable to conceive. Usually, in a U word, there's a question where the Turner syndrome is having a baby, but in that one, it's very like uncommon because they have streak ovaries and usually they're infertile. So that's how I kind of memorize. Like I saw a question, but book has said this. So I keep it exceptional in my head that it is basically infertile. Along with that, it has webbed neck, broad chest, space nipples, lymphedema, coarctation of aorta. One of the most common thing are the genital, sorry, not genital, cardiac diseases. Which cardiac disease is linked to with which one? So if you are missing anything, like I'm not saying you can miss the cardiac portion of the pediatrics, but let's suppose you don't want to do anything, at least know which cardiac disease is linked with which syndrome. One of the most favorite thing, like coarctation of aorta is linked with Turner syndrome, bicuspid aortic valve is linked with which disease, and increased risk of hypertension, then sway spectrum with the mosaic and normal intelligence. So one of the most common is basically they are having normal intelligence and they can live a normal life. Then comes the Klinefelter one. This is basically 47XXXY. Everything is tall, big. So they are long lives, gynecomastia, facial hair, mild intellectual disability. They can live them by themselves as well. They also have infertility. Then comes the Fragile X syndrome. They have over overgrowth. So if you see what's the difference between Klinefelter and Fragile X, in Fragile X, everything is overgrowth, but in Klinefelter, everything is tall. Okay. So here is nasal bridge with the long and thin face, large protuberant ears, macroorchitism. Complications is seizures, mitral valve prolapse. I keep on saying again and again, I had a very bad experience where I did not know which heart condition is linked with which one. So I would suggest you guys know this one. Okay. Mild to moderate intellectual disability, then at ADHD, which disease is linked with ADHD or which syndrome is linked with ADHD? So I think it's linked with Down syndrome. No, it is linked with the Fragile X, not with the Down. Autism is linked with the Fragile X1, the premature carrier, and then molecular FMR1, PMS, and that Southern blot test. So in this one, I just kind of read it up to that level where it help me making the diagnosis. So you don't need to know the genotype. I mean, you need to know which one is autosomal dominant and autosomal recessive one. I will share the table which I did, okay? Then clinical features in the deletion syndrome, it's a D George. What is there? The most important here is having thymic hypoplasia immunodeficiency. So, and then hypoparathyroidism, hypocalcemia. So there is this one. Then comes in this one Prader-Willi. In this one is hypotonia, weakness, hypogonadism, hyperphagia, obesity is there. Like he's eating a lot and he's obese. Then the angel man, I feel like he's having more smile. So you can see that they have large mouth and fair hair and mid face. So large mouth can give you an idea that he's angel. Then Noonan syndrome, it has a short neck, and Noonan syndrome kind of resembles Turner syndrome. But what is the difference between here is it has like a short stature, webbed neck, hypertelorism, epicanthal folds, pectus excavatum is there, but in that one there is wide like nipples and all that. It does not have pectus excavatum. Increased risk of hematological cancers, cardiomyopathies, and intellectual disability. Then comes the Charge syndrome. It has like a Charge globoma, congenital heart disease, choanal atresia, GU, and then ear syndromes. Then when we are talking about this one, at least know the familial adenomatous polyposis. This one is common, and in that one we do every like at age of the 10 we do sigmoidoscopy. In love leaf from Money syndrome, at birth we have to do the pelvic ultrasound. In women 20 to 25 we have to do annual breast MRI. Then 18 age we do the annual dermatology, and then 25 is the colonoscopy. Then for the Lynch syndrome, so which one is more important? Lynch syndrome, familial adenomatous polyposis, hereditary breast and ovarian syndrome, at least these ones. And I recently saw a case of the von Hippel-Lindau syndrome. I don't know. I never thought I will see in my whole life something like this, but I saw. So Then Lynch syndrome is age 20 to 25. In that one, we do colonoscopy. And then in 30 to 35, we do colonoscopy every 1 to 2 years. In familial adenomatous polyposis, we do sigmoidoscopy at the age of 10. Then when it comes to breast and ovarian, it's very, very common. A lot of female do present by my mom has breast cancer, or in that one, we do go for BRCA. And usually they ask for if you are going for BRCA, is the female more having chances of cancer? So whoever has family history of BRCA, it does not mean that if their BRCA is positive, they will have the cancer as well. Because of the genetic factor, it will be positive, but you cannot tell that. Okay. So although we keep doing mammogram, we do keep doing ultrasound. In some cases, we go for MRI as well. Then von Hippel-Lindau syndrome, in that one, age is annual physical examination, baseline, age 12, 15, and 18, we go for MRI, brainstem, spine, and this one, age MRI every 2 years. Then if you can read this one, then we are talking about neurofibromatosis because stage 2 is kind of important. Vestibular schwannoma is one of the most important thing and can cause hearing loss. So that's why in this one, we do audiology assessment. Okay. And the question is like this: neurofibromatosis, what are the screening tests or what is the assessment that you would like to do? So audiology screening, although we go for brain MRI, blah, blah, blah shit, but physical examination is basically the audiology assessment. Don't forget about that one. You have to completely mention that one. Type 1 is basically children evaluation for neurodevelopmental, annual physical exam, growth and blood pressure, bone assessment, all of that one. Mm, Then in this one is vascular Ehlers-Danlos syndrome, then classical Marfan syndrome. So usually the tall and this one. There's one thing here. One has a lens displacement anteriorly and one has posterior. I'm not sure which one has where. So just look at that one. Like there is a lens detachment. One has anteriorly, one has posteriorly. Okay. Then when we are talking about hemochromatosis, iron overload is there, arthralgia, bronze bodies, hormonal disturbance is there, which hormones can be disturbed in hereditary hemochromatosis, diabetes and hypogonadism. Okay. Duchenne muscular dystrophy. Okay, this one is in that one. What you need to know is the positive Gobber test, Wedling gait, and the toe deformity. In this one, what you need to know is this one here. It's an X-linked recessive disorder. And it has a very high chances of having cardiomyopathy. And what is the test that you would like to do is basically DMD, the first line. Then go for genotype. Family history is very, very important as it's X-linked. Creatine kinase EMG, sportive cardiac health monitoring, and early intervention. So checking for cardiomyopathy is one of the most important for other things like vitamin D, bisphosphonate, steroid, and all that. As you can see, death due to pneumonia, respiratory failure, CHF. Okay. Then in this one, if you are like, it's good if you do everything. If not, at least do galactosemia. Okay, then when we are talking about this one, in the galactosemia, the hypoglycemic episodes are one of the most common. And when the child is having over and over hypoglycemic episodes, in that cases, we go for galactosemia. And we recently saw a child of galactosemia too, okay? Then it has hepatomegaly, liver failure, cardiomyopathy, growth retardation, failure to thrive. In this one, we do elevated liver enzymes, hypoglycemia, lactic acidosis, hyperlipidemia. Infantile cataracts, hepatomegaly, muscle weakness, and cramps are there. Which other has the, yeah, in this one, sudden infant death is very common. In which one? Fatty acid disorders. Okay. Then if you have idea, you can read Hunter, Hurler, Niemann-Pick, Stay-Sack, Coucher, Fabry, Krebs. So when I was doing it, I did everything. Okay. So I won't stop you doing all of them. Early investigation is going for all the tests, send the labs to check for whatever the enzymes or whatever is missing in the body. Then checking for the lactate, ammonia, plasma, urine analysis, ketonuria, checking for the glucose or which protein is present in the urine. Then comes the treatment. When we are talking about the treatment, you have to just replace those enzymes. Here you can see the galactosemia. In galactosemia, the most important is the cataract formation. In early childhood, if there is a patient present with the cataract, Don't forget the galactosemia. And when we are talking about phenylketonuria, there is something here. Hypopigmentation due to low tyrosine levels. So they do have hypopigmentation, or there is a musty order. When we are talking about MSUD, they have mental retardation. Okay, I'm just highlighting the important words. Otherwise, you can go for everything. And they even have the cerebral edema and death if inadequately treated. So these children do may die later on. Then GSD or a Gierke disease, in this one, they have doll-like faces. I mean, these are the words they will definitely put in the MCQs if they are looking for this kind of diagnosis. And in this one, they have hyperuricemia, hyperlipidemia, delayed puberty. So if you think of a child can present with high blood pressure, hyperlipidemia, don't forget this one. Okay. Hepatic adenoma osteoporosis is one of the most common. And they often have hypoglycemia. So it goes with the differential diagnosis of other one. Then which one? The galactosemia. Then the Tay-Sachs disease, in this one, the main important is hearing impairment. Okay. Yeah, and here I was talking about, when we were talking about galactosemia, there is one of the infection, like it is very, these children are very prone to sepsis. Okay. And which infection? E. coli, I think that's what it is. Yeah. So you can see here complication, increased risk of sepsis, especially E. coli. If the diagnosis is not made at birth, liver and the brain damage may become irreversible. So these are the important words from here. So how do you prevent the sepsis? Before screening results reported elimination of the galactose from the diet, and most commons are fed with the soya-based diet. So most important is which diet you have to introduce. That's why I told you in the start of pediatrics, you need to remember the formulas. Okay, so that's about it from geriatrics. What I told you, at least do that one. But if you have time and you feel like you want to do more, then definitely the whole chapters is yours and you can do as much as you want. Okay.